can have a heart attack and not even know it. I'm Dr. Voss, longevity doctor with an MD from Cornell. And yes, I know it sounds hard to believe, but some studies have estimated that up to 45% of all heart attacks are silent. That means no chest pain, no shortness of breath, no dramatic collapse, just subtle signs or even none at all. So what is a silent heart attack? It's called a silent myocardial infarction, and research from the ERIC study and the American Heart Association show that these events are surprisingly common, especially in people with type 2 diabetes, high blood pressure, sleep apnea, and those with excess visceral fat. In one group of symptom-free adults, 22% showed evidence of heart damage on testing, despite having no cardiac diagnosis. The scary part, silent heart attacks leave behind scar tissue, just like the big ones. And that damage can increase your risk for a number of things, including heart failure, dangerous dysrhythmias, and even sudden cardiac arrest. And because these silent heart attacks often go untreated, they may be more dangerous in the long term. A study in JAMA Internal Medicine found that people with silent heart attacks had a 3-time higher risk of dying from heart disease over the following 10 years. What symptoms should you look for? They're easy to miss. Unusual fatigue, mild shortness of breath with minimal exertion, even nausea or lightheadedness, and sometimes discomfort in the jaw, upper neck, or back. Women and people with diabetes are especially more likely to have these atypical symptoms. What can you do? Well, if you're over 40, and particularly if you have risk factors like high blood pressure, high fasting insulin, or a significant family history of heart disease, consider a thorough preventative check. Ask your doctor about things like a resting EKG, a coronary calcium score, or even better, a CCTA with clearly analysis, or even consider things like an echocardiogram and lab work that is usually not run with typical baseline labs, including high sensitivity CRP, apolipoproteins, and homocysteine. And remember, never overlook the basics. Eat a Mediterranean-style diet, emphasizing olive oil, leafy greens, and omega-3s. Get that zone 2 cardio in. Brisk walking or cycling for at least 150 minutes weekly. Try to target 7.5 to 8 hours of sleep nightly, and practice stress reduction, box breathing, physiologic sighs, sauna, or even daily sunlight. Heart disease doesn't always announce itself with a bang. Sometimes the signs are whimpering and easy to miss. If you've ever brushed off unexplained fatigue or discomfort, it might be worthwhile to pay attention. It's possible it could be more than nothing.